Doctors of Reddit, what's your thank God they came in for a second opinion moment? I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else as I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time, and of course, those are the patients that have a brain tumor show up on their CT scans. Edit, well, this blew up? Big apologies to everyone, but I'm not a doctor. I work in the hospital alongside other doctors, and I get the chance to see everyone they see. Apologies if I misled. That was not my intention, and I will make sure to be clearer next time. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility, big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson, look at your patient. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I went to my former doctor about a mole on my arm that I thought had gotten larger, and asked him to biopsy it. He looked at it carefully and told me it was fine, but I insisted and things got a little testy, but he did it. It was a malignant melanoma, and had it gone 1 millimeter deeper I'd have been grounded for 5 years from my pilot job at best, or suffered dire health consequences at worst. After a surgeon removed a big chunk of my arm excising the melanoma and surrounding tissue, he told me to be sure to thank my regular doctor for saving my life. In the time since I've become well acquainted with your specialty as my first line of defense, having moles mapped and checked every 6 months for a while, and now every year. It sure as hell isn't all Botox and laser hair removal. How did your OG doc react when it came back as melanoma? That's a pretty significant miss. I am a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. Edit, thank you readers. Never thought these 2 sentences would explode like this. Thank you very much for the silver and gold. Thanks to all who follow. This is an important distinction because often if the doctor forwards your file to a different doctor they'll flavor it with their interpretation. As a mental health patient this is one of the most infuriating things imaginable. Once you're diagnosed that's it. No one will ever look at the evidence again. They'll just assume the previous person got it right and then add whatever you say to that, but the original diagnosis was about 10 doctors ago. So basically I've gone to the GP, told them what's wrong, had them write it down, and then another GP has come along and read what they wrote and reinterpreted it, and then another does the same, then another. I no longer have any confidence that my diagnosis is even remotely correct because the doctors have basically been playing rumors with my file for a decade. Once you're diagnosed that's it, I can relate. I think I've been misdiagnosed but no doctor will listen. I'm extremely tired to the point where I can't walk for more than a couple minutes. Everything hurts, really badly. I'm only 30 and somewhere between 55 to 58 kilograms. Doctors just tell me I'm depressed because that's what has been written down by other doctors, major depressive disorder, or they think I'm some junkie looking for pain meds because I can't pinpoint just one area that hurts. Once a psych patient, always a psych patient. Edit, thank you lovely Redditors who have commented or messaged me about fibro. It's something I'm now looking into. I found an interesting article about touch points for fibro that are particularly painful when pressed, not even hard, and 5 minutes later some of them still hurt from being pressed. I'm going to start a journal with how I'm feeling and present it to my GP during the next visit. Yeah, it's like my skin itches, and my neck hurts, and I've got a runny nose, and my stomach is upset, and there's a pain behind my right eye, and a cut on my leg that doesn't seem to be healing correctly. Yeah, that's depression for you. What, all of it? Sure, why not? I'm not a doctor, But I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. #X200B. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. #X200B. Around 1 a.m., I was screaming on the floor. #X200B. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. I've had bacterial meningitis too, probably the worst pain of my life. I wanted to kill myself at one point during it. I was pregnant and couldn't take any pain meds besides Tylenol. Worst experience of my life. Did having that while you were pregnant have any effect on the baby? Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed, and that I would be talking to our mutual chief of clinical services about the incident. Edit. 1. Thanks for the silver. You all rock. Symptoms were all in his head, to be fair, it was all in his head. And possibly spine. Way. Took me a few years to finally get my MRI and multiple sclerosis diagnosis. It is a bitch to get taken seriously for, so thank you for that. Nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy shit. House knew all along and used playing with the child as an excuse. All because the kid wore mismatched socks. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. 1 stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit. He lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Edit 2. For those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15 to 34 can be done, but since rare, 5100,000, not a general recommendation. I think the other doctor should get his testicles checked too if he thinks lumps are normal. 1, 2, 3. 3 lumps, all good. My uncle isn't the smartest guy. He's also like 500 pounds and showers maybe twice a year, so he's a gross dude. One time he was bragging that, at 40 years old, he had grown a third nut. Told everyone about how he defied science and now has 3 balls. Turned out to be an abscess, and now he hates that story being told. Not a doctor, but I heard my son's doctor say this. I took him to the ER late one night because of coughing and a high fever. They took an x-ray, gave him ibuprofen, and told us he was fine. Doctor showed me the x-rays to prove it and gave me a dirty look when I asked what the dark spots were. I told her she was an idiot and took him to urgent care 4 hours later. The doctor that saw him immediately diagnosed him with pneumonia and confirmed with x-rays. I flat out refused to pay for the ER visit and told them that if they persisted with collections I would push their incompetence. They never called me again. Edit. This really blew up. I would like to thank all the fine medical professionals out there for explaining dark spots on x-rays. These are the exact answers that I was expecting for my question to that doctor. The fact that I did not receive any explanation of any type and received backlash at the mere questioning of a diagnosis would indicate some type of insecurity or complex that makes the doctor put their time and feelings ahead of my child's health. The fact that all of you spent a few minutes explaining and typing this on Reddit really makes that doctor look really bad, considering she couldn't spend 30 seconds giving an explanation.